Hello everybody. So what we're going to do today is we're going to be going over inclinometers and measurements for range of motion for the spine. And so our first video is going to be just over all of the cervical ones. The cervical ones are fairly easy to do and remember, and then we'll do separate videos for the thoracic and the lumbar measurements. So to begin with, this is your inclinometer. Okay, it's really just a bubble level, right? And so, but we use the fluid inside it to kind of achieve a level, and we, based on how much it moves, right, you can tell how much of an angle we have. So it works a lot like a goniometer in that we can get range of motion movements for that. So you just want to start off by getting it where you're going to be, and then turning this dial until it says 0, right? So, and there's an arrow that points to the 0, if you'll notice right there, right? And so that'll kind of give you where you want it to point to where the blue fluid starts, okay? So you can go ahead and back out, Noah, and we'll do the first test. So our first test is going to be cervical rotation. With cervical rotation, you only need one of these inclinometers. With the rest of the cervical ones, which we'll do here in just a second, you need two. So before you start, you always want to make sure you wipe down and clean the inclinometer with an alcohol wipe or swab, which I have already done. But make sure you keep them clean and you keep everything healthy, right? Sanitized and healthy so that we don't spread any germs. So with this first one, what you do is you just place it on the patient's forehead. They're laying on the plinth or the high-low table in supine, right? And you just place it on their forehead, and then you zero it out like I'm doing right now. So I've got the 0 leveled out, and it should be 180 on the other side. And then what I'm going to have you do, Karen, is I'm just going to have you turn your head as far as you can to the side. You want to look and watch and make sure that she is not, your patient is not compensating and trying to turn the thorax, their trunk at all, that it's only cervical rotation. Okay, so go ahead and bring it back for me. I'm going to get it zeroed out, and I'm going to have you do that action for me. Good. So keep it on the forehead, and her cervical range of motion is 85 degrees. You can come back, and then you go the other way, right? Same thing. Have her go ahead and so turn to the left now. Good. So to the right, she is 85 degrees. To the left, she is 80. Okay, so she's got a little bit more to the right than she does to the left, which may mean she's actually got some tightness on this right side. But normal range of motion, she's within normal range of motion. And so that's how you use an inclinometer for that. Okay, so once you have done cervical rotation, you at least know the concept of zeroing out the inclinometer. So the next ones we're going to do are the rest of the cervical ranges of motion. We're going to start with cervical lateral flexion. So what you want to do is find C7 to start with. And so I'm going to have my patient lean her neck forward. And you can see very prominently this part that sticks out, that's going to be C7, right? So we want to find T1 actually is our goal. So we just want to go down 1 from there so that we're isolating the cervical vertebrae, and we're making sure that we're not actually measuring thoracic movement, but only cervical movement. Okay, so go ahead and bring your neck back now. I've got it. I've taken this piece of tape. You can also use a marker to mark where that is. Find C7, move down 1 spinous process to T1, place the tape or the mark right at the center, so the top of the tape should be right at the center of T1. Okay, so for lateral flexion, you want to put the goniometer kind of along that frontal, not the goniometer, sorry, the inclinometer along that frontal plane, and then zero it out like I showed you with rotation. So you want one here, right, parallel to the tape, and then you want one just sitting on top of the head and zeroed out as well. Okay, so when you've got it zeroed out, you just have the patient laterally flex their head to the side. So Karen, can you move your head to the left? Okay, keep it right on the top of their head, and she has moved it 50 degrees of cervical flexion, but she also has, on this, she's gone into 5 degrees of thoracic flexion. So we deduct that, which makes it 45, which is normal. Normal range of motion for all of the cervical ranges of motion is 45 except for rotation, and each side rotation is 60 degrees. I'm not going to have her go to the right because she's having pain, but it's the exact same process to the right. So you take the top measurement as far as it goes past the 0, okay, and then you subtract the thoracic measurement and how far it goes past 0. So the next one we're going to do is cervical flexion, okay. So same concept, you just place the inclinometer. Sorry about that. I'm gonna always make that mistake. You want to place the middle of this little arch right here, right on the top of the tape. You're gonna zero it out there, and then you're just gonna place the other inclinometer right on the back of the occiput there, and zero it out.
I feel like physical therapy assistants need like 5 hands.
It would be nice, right? I'll switch hands here. So, now that I've got it zeroed out, I am going to have her move her head into flexion, okay? And she has what looks like 60 degrees here, and take off 10 degrees here, so come on back, which is 50 degrees, which is normal, okay, a little past normal actually. And then for extension, which is our last one for the cervical spine of measurements, we want to, instead of using this tape, we want to find a place along the spine of the scapula. So we're just going to find the spine of the scapula, place it on the spine of the scapula, and zero it out from there. And then once again on the occiput up here. The reason we're placing it on the spine of the scapula is when she extends her head, we don't want the 2 inclinometers to hit each other. So we just move it to the spine of the scapula. So Karen, could you extend your head back? Good. She has very good extension. I'm going to look over here and read it, and about 70 degrees and 5 degrees, so she's at 65 degrees of cervical extension, which is actually beyond what is normal for most people, so she has good mobility there, and that's how you do your different cervical inclinometer measurements.